name is Dr. Michael Davidson, and this is my video series entitled Better Than a Flu Shot, How to Enhance Your Immune System Naturally. In my last video, I talked about the dangers of just taking random supplements, for example, from a pharmacy shelf, without actually doing the due diligence and research necessary to ascertain their quality. In most cases, choosing a supplement at random is at best just a waste of money, and at worst can be dangerous. But in this video, I'll actually be talking about some supplements that improve immune function and are actually worth taking, assuming that they are high quality. So today I'll be focusing on pre and probiotics. If you'd like to know more about supplements that are actually worth taking, I'll be doing a separate video for that, and you can check that one out in the link in the description of this video. So without further ado, as I mentioned, there are supplements that are worth taking that can, in fact, support our immune function. And for instance, probiotics, they're beneficial microorganisms or beneficial bacteria that they are actually also commonly sold as pills or powders, and they include strains such as lactobacilli and bifidobacterium. Also, for instance, Saccharomyces. These are commonly marketed with various health claims, but I'll be taking a look at what the actual science says as far as their benefits. So they actually may have immune-enhancing effects, as indicated in a number of clinical trials. In one study, participants were given probiotics for a few weeks and had boosted WBC, which stands for white cell, or the cells in our body that fight off infection, and natural killer cell activity. So when they took these probiotics, it boosted their immune cells' ability to fight off invaders. NK cells stand for natural killer cells, which are a type of cell critical in eliminating, for instance, tumor cells like cancerous cells and, for instance, certain viruses. And when they took these probiotics, even a few weeks after the probiotics were stopped, these immune cells stayed more active. And just to go through just some other examples of research in this field. Other high-quality studies also show that those taking probiotics may have significantly fewer colds, fewer sick days, and a lower risk of upper respiratory tract infections like, for instance, the cold or flu. And these probiotics may be especially helpful following a course of antibiotics, because, of course, antibiotics wipe away and destroy the good bacteria that actually support our immune function. And this graph shows, it's from a study which shows the effects of, in this case, lactobacilli, a type of strain of probiotic, on the white cell activity and their ability to actually chomp up and eliminate or destroy various pathogens, so disease-causing microorganisms. So if you think about, for instance, these cells, you can imagine them like Pac-Man, which these little Pac-Mans that go around and chomp up and destroy invading various cells that can, bacterial cells and various pathogens that can cause disease. So you can see as time progressed with the use of these probiotics, their ability to actually eliminate and chomp up these pathogens was enhanced with the use of these probiotics. And this graph shows also their ability to actually destroy cancer cells. And it shows how these NK cells, which I mentioned earlier, can actually be bolstered in their ability to fight off these cancer cells. So by week 6, their ability of these NK cells to destroy cancer cells was greatly improved. And in this case, we're looking, this study shows a different strain of probiotics called bifidobacteria. on also on the ability of NK cells to eliminate and destroy cancer cells. So you can see don't get thrown off by all these scientific names here, but all these graphs show is that the use of this probiotic increased both the ability of these natural killer cells to destroy cancer cells and also other immune cells' ability to fight off foreign invaders as well. So prebiotics are food components. Again, notice prebiotics is different from probiotics. Probiotics are beneficial microorganisms that can support our health, and I already demonstrated how they can support our immune function. Prebiotics, on the other hand, are these food components that are found in the healthy food that we should be eating every day. They're found in components like fiber, so things found in green leafy vegetables, fruits, nuts and seeds, and legumes. And these components in these foods, like these various indigestible starches, they actually feed the good bacteria in our gut. They help them grow and divide, and in turn, these good bacteria then help us. So there are components like fiber. What the scientific evidence shows is that these prebiotics may be even more important than the actual probiotics. So raw fruits and vegetables have actually both pre and probiotics because they contain both beneficial microorganisms and the components that these microorganisms take in as food. And of course, this can contribute to their immune enhancing effects. So, as the scientists explained, the protective effect of plant-based food, right, you can think of something like a piece of broccoli or some kale, may also be mediated through effects on our intestinal bacteria, right? The intestinal flora or microbiota, the environment that consists of these various good and bad bacteria that reside in everyone's gastrointestinal tract. What about fermented dairy products? What the science shows is that they not only have many harmful compounds, but may not even be effective sources of probiotics, unfortunately. So this would include things like yogurt. And the reason is there's a number of harmful effects compounds found in dairy, including things like yogurt that can be damaging to our health, as well as the fact that any beneficial microorganisms may not be present in large enough quantities in fermented dairy products like yogurt to be of any benefit to us, unfortunately. Supplement sources of probiotics, when compared to things like yogurt and other fermented dairy products, may be far safer. Nonetheless, as with all supplements, quality still should be ascertained. So quality is always a concern. It should be noted that probiotic supplements are contraindicated in those with acute pancreatitis. To give you one example of a study, there was a study in which they compared people who were taking probiotics and in which they looked at different supplements off the shelf of a health food store and compared in particular the probiotic supplements, and they found that 30% of probiotic supplements actually contained what the label claimed. In other words, 70% did not. So the minority of them actually contained what the label claimed. But what about the value of probiotic supplements despite this? Assuming again their quality is good, they do have, as mentioned before, beneficial health effects. And another thing we have to consider is the probiotics. So when someone is using them, they have beneficial effects, but they're not actually viable in our gastrointestinal tract. In other words, they don't become part of the native, population of good bacteria in our gut and start reproducing. They don't join into that population. Rather, they actually pass through. Now, as they're passing through our gut, they do have beneficial effects, assuming they're viable, in other words, alive and good quality. But once they're out of our system, these effects will not persist. They may persist for just a few weeks, but yeah, after that, those bacteria are not actually going to be living inside of us. They're just going to pass through us. So now I'd just like to give you a tip on how you can test the quality of your own probiotic supplements. It's just a simple experiment, and it just requires the supplements and a glass of soy milk, or you can use dairy milk. What you do is you fill a glass with the milk, and then actually fill 2 glasses with milk. In one of those glasses, put in the contents of about a teaspoon of your probiotic powder, which is about equal to 4 or 5 capsules. You can open those out and sprinkle the contents into one of those glasses. And you just leave them out room temperature overnight. In the morning, we check the consistency of both glasses. The one that you put in the probiotics, that glass, you might want to label it or somehow designate that to be the glass that you put in the probiotics into, so you know. It should have a changed consistency, because the probiotic organisms are going to start fermenting the milk. So what you should see is either bubbles of carbon dioxide or curdling in the milk starting to occur, some chunks, or like a film, like a yogurt kind of film glaze. Now, if there's no changes, you can wait one more day. So leave it out again overnight and come back the next morning and check the consistency. If you don't see the changes that I described in the glass of milk that you poured in the probiotics, that means your probiotics are probably not viable, meaning the organisms were never alive to begin with, and you should get your money back and get a different product. So it's just a simple kitchen counter experiment you can perform, and this should give you some clue as to the quality of your probiotic supplements. I hope that's of help to you. I'm Dr. Michael Davidson. Please be sure to like and subscribe. Thank you very much.